Hi, I'm Dr. Prem Anand here. I'm here today to talk on HBOT. So there is a lot of curiosity on this hyperbaric oxygen therapy. So it's a magical drug, we can say that it cures many, but though there are less evidences of what it can do actually. So there are a lot of myths about this hyperbaric oxygen therapy. So what is this HBOT? So here there are so many things are available in the market calling that they are saying that they're giving the hyperbaric. So the hyperbaric oxygen is nothing but you get into a chamber. So first let me tell you what are the differences in the chamber. So we have something called mono multi chambers, and then these chambers comes with different atmospheric pressure. So when we talk about a mono chamber, the individual gets into the chamber and gets sealed inside, and then he breathes 100% oxygen more than the atmospheric pressure of 1, which we usually live on. So you can go up to 3 atmospheric pressure, that is 3 times of the normal one. And the similar is in the case of the multi-chamber. But here the client is going to be with the multiple people around, maybe 2 or maybe 3 or maybe 4. There are so many chambers which can go up to even 12. Here they breathe the oxygen with a mask. So the mask is tied to their face, and then this is clipped on, and then the pressure is increased in the chamber through the air, and then they breathe the 100% oxygen. But here what we are having is called a mono chamber. And in this mono chamber, what happens is the client gets into the system or the device, and it is sealed. So this comes with a submarine quality glass which can hold the pressure of 3 atmospheric pressure. So the whole chamber is being pressurized with the oxygen, and when they breathe this, the absorption into the body is very in a high. The oxygen concentration is on a very higher level, where the evidences says that it repairs the cell damage, it gives you an anti-aging effect, it helps in detoxification from the drugs or alcoholism by giving you 100% saturation of oxygen in the blood. So even the wound recovery or the wound damages or the non-healing ulcers like diabetic foot or post-cancer, this works as a miracle. Though there is no evidence saying that this has been documented in the as a treatment, but this is always suggested as an adjunctive treatment. So post the treatment of any cancer or for any non-healing ulcers or even a neurological damages by congenital, that is by birth, or due to any trauma. So this has an evidence of giving a very good and amazing and miracle recovery. But this has to be planned in number of sessions. So once we have a consultation with the client, depending on the the stages of what they are or in what's recovery they are looking for, or even as an anti-aging. So depends on the age and the what sort of recovery they are looking at. We can plan number of sessions. Usually this is done weekly 5, and we give 2 days of recovery phase, because high load of concentration of oxygen is also damaging to the body. That is called hyperoxia, which we don't want that. So we give 2 days of a recovery, and then again we start Monday to Friday 5 doses. So depending on the concentration level or depending on the recovery, we can plan the how much of ATP, that's called atmospheric pressure, we need to take, or how much of oxygen to be given, and the duration of period, how much to be given. Either it is 60 minutes, 90 minutes, or something like that. So we always customize it depending on the requirement of the individual client. And coming to this hyperbaric oxygen therapy, so there are some, this 1.5 ATP, that is 1.5 atmospheric pressure machines, which comes in acrylic chamber and with a small compressor sort of a thing which delivers the oxygen. So this is of no use and has no, of any medical importance or clinical results will be seen in these machines. Most of the machines are available at home care use, which they say is equal to HBOT, which is very unlikely. So the HBOT, or the real machine, or the FDA approved machine, is how it comes with a natural, those submarine type of a glass which can hold that sort of a pressure, that is the 3 atmospheric pressure, and the oxygen is directed from the oxygen manufacturing plant, from the direct line drawn to the chamber. So this gives the 100% oxygen without any adulteration or without any concentration difference, and gives you the pressure out at all time. So there should be no drop in the pressure, which can again change the clinical results. So this is how the FDA approved machines work. And this hyperbaric oxygen therapy, when taken as an anti-aging, it gives you amazing differences in the cell damage recovery and also from the UV damage. So you can expect your down aging of 10 years from the wrinkles and from the UV damages and from the pigmentations. And it gives you an amazing freshness and the youthful glow, and you are brisk. You'll be very fresh and very brisk in life, as if you have just got up from the sleep. So come try with us the FDA approved hyperbaric chamber with us and see the difference of what HBOT can do for you.